This is a slide presentation describing the Inpatient Red Cell Transfusion Stewardship project recently implemented in Manitoba. Manitoba is one of the highest users per capita of red blood cells. Each unit transfused is associated with risk. This is a graph that shows recent utilization data for Canada. You can see that Manitoba is one of the highest users over all of the years for red blood cells, and that while we are decreasing utilization, not as strongly as some of the other provinces. So Ontario and Saskatchewan, for example, have recently implemented similar projects to reduce utilization of red blood cells and have had significant success. This is the red blood cell utilization guideline for inpatients. This one page is a quick reference describing the project. So looking at the practice guideline, red blood cell transfusion is indicated for the treatment of symptomatic anemia. So for non-bleeding adult patients, a single unit transfusion is recommended. And before a second unit is requested, evaluation of symptoms and hemoglobin should be performed to assess appropriateness. This is one of the key components of this protocol, whereby a single unit transfusion is recommended as opposed to traditional 2 units or more in anemic non-bleeding patients. Appropriate transfusion ordering practices will enhance patient outcomes, improve safety, and reduce utilization. And over time, we do hope to significantly change ordering practices in Manitoba. Inclusions, this is key to our success. Adult, hospitalized, non-bleeding inpatients are included in this protocol. When the lab goes to issue the blood, they will be looking at patient location to determine whether they're non-bleeding and hospitalized. So looking more closely at exclusions in item 4, these are intraoperative requests including the recovery room. The assumption there is that patients are bleeding. Emergency and critical care for the same reason. Outpatients, that's a little different reason, but it's more for logistically serving these patients efficiently as they're traveling to receive their red cell transfusion. Number 4, massive transfusion protocol for those sites that have it and for obvious reasons. Labor and delivery areas, including recovery room. Again, the assumption is those patients are bleeding and require red cell transfusion immediately. Pediatric patients are excluded from this protocol. And finally, number 7, patients with hemoglobinopathies such as sickle cell disease or thalassemia. So it would be important in all requests to include that information in the indication for transfusion. Number 5, this describes the process for the clinician that is presently considering order of red blood cell transfusion. For the patients that have most recent hemoglobin is 70 grams or less, you're to order 1 unit of red cells and complete the request for release. A repeat hemoglobin is required before issue of the second unit. The repeat hemoglobin can be done immediately after the completion of the single unit transfusion. In the patients with a hemoglobin of 71 to 80, again, to order 1 unit of red cells if indicated and complete the request for release. Transfuse the single unit, evaluate symptoms, and repeat hemoglobin prior to the request of the second unit. This is key, as in after 1 unit of red blood cells, it's quite possible that the second unit is not appropriate anymore or is not required. In this range of hemoglobin, all requests will be reviewed for appropriateness by the transfusion medicine physician. So that's not an immediate approval for this range, but there will be a discussion with the ordering physician and the transfusion medicine on call within a day or two to talk about whether alternatives could be offered or if it was truly appropriate. And this part of the protocol is aimed at changing ordering practices over time, because educating ordering physicians on a case-by-case basis is known to improve ordering practices in the future. And finally, if the most recent hemoglobin is 81 grams per liter or greater, an immediate approval by transfusion medicine is required. So the lab will not issue the red blood cells without approval for this hemoglobin range. The most recent hemoglobin value to be used should be the same day or within 24 hours of request. Clinicians can always contact the transfusion medicine physician on call, that's 24 hours a day, to collaborate on patient blood management through hospital paging system. The HSC paging system will have access to the transfusion medicine physician on call, and blood banks will also have a call schedule to determine the transfusion medicine physician on call. And this isn't always for immediate approval. If there's any questions in regards to the protocol, or if there's case-by-case discussion wanted for how to manage an anemic patient, you can call the transfusion medicine physician on call. Number 7, most importantly, is transfusion-associated risk. Anytime that a red blood cell transfusion is considered, one must consider the risks associated with each and every red blood cell transfused. So this slide talks a little bit about the other effects of a transfusion of red blood cells. So while it does improve oxygen carrying capacity and hemostasis, there's other more adverse events that happen when a red blood cell unit is transfused. And that is there's cytokines, antibodies, and allergic proteins, some hemolyzed products, remnant white blood cells, and transmissible infections potentially transfused at the same time. So this is some evidence in regards to how soon the repeat hemoglobin can happen after the first unit of transfusion. And this is some evidence that shows that within 15 minutes of the completion of a single unit of red blood cells, the hemoglobin is accurate. So we're recommending no delay after the first unit is transfused if a second unit is being considered, to draw that hemoglobin within 15 minutes.
Currently in Manitoba, whenever a clinical unit requires blood or blood products for a patient, they're required to fill out a request for release form. We currently have one request for release form for all products in Manitoba, including red cells, blood components, and blood products. With the implementation of the Red Cell Stewardship Project, we have decided to implement 2 specific request for release forms. One will be specific for red cells, while the other will be specific for blood components and blood products. Today we're going to review the request for release form specific for red blood cells as it pertains to the Red Cell Stewardship Project. This form has its own document ID number and SAP number, which we will provide you with at the end of this presentation. On the request for release of red cells, we're giving you guideline reminders as they pertain to the Red Cell Stewardship Project. Under important notes, we are reminding you that the Red Cell Stewardship Restricted Protocol only pertains to non-bleeding hospitalized patients. We are encouraging single unit red cell transfusions, and that is the standard for patient care. Additional units will definitely be issued after reassessment of patient and repeat hemoglobin by clinical team. As you heard prior, you can repeat the hemoglobin 15 minutes post-transfusion. Incomplete forms may result in delay or rejection of this request. It is vitally important that all aspects of this form are complete in order for the lab to process your request as quickly as possible. We've also provided contact information for HSC paging should you require TM physician consult. At the top of the form, we've included the transfusion criteria for stable non-bleeding patients. As you heard before, if the hemoglobin is less than 70, the red cells will be issued by the blood bank without delay. If the hemoglobin is between 71 and 80, the order will be screened. What that means is that the unit will be issued to the patient. The red cell request form will then be scanned and sent to the TM physician on call, who may at their discretion contact the ordering physician and have a discussion with them as to why the patient had been transfused based on that hemoglobin value. If the hemoglobin is greater than 81, a TM consult will be required. The blood bank will not issue the unit. The area for the clinical unit to complete is very important. The first thing we're looking for is the patient's hemoglobin, the date and the time that the hemoglobin was drawn. It is really important that that hemoglobin result is within the past 24 hours at best. It is important that we have the clinical unit and the phone number for contact, the date and time that the product is required, the ordering physician, the diagnosis, and the clinical indication. A low hemoglobin would not be considered a diagnosis as we move towards this restrictive transfusion. It is very important that a diagnosis be provided in order for the blood bank to request this release appropriately. Under Section 1 for patient condition, does the patient have ongoing clinically significant bleeding? If the answer to this is yes, then the patient will not apply under the protocol as it is stated. This patient will be exempt from the transfusion criteria. Under Section 2, red blood cells required. For routine patients, select routine and the number of units. Typically, 1 unit is released at a time. If it is for an emergency patient, please select emergency and again the number of units required. For neonatal patients only, this section will apply only to those sites, such as HSC and St. Boniface, that have pediatric patients that will be allowed to have divided units. Special transfusion requirements are also required should you be requiring washed or irradiated units. The bottom of the request form is for red blood cell issuing information. This section is primarily for the lab to complete, whereby the transporter name is included and the date and time. For those sites that do have a pneumatic tube system, there is a section there where that information can be filled out. And at the very bottom of the form is where the clinical site can verify they've filled out the form appropriately, or if the unit has been transported by pneumatic tube system. A communications package will be distributed. This will include a clinical practice change which outlines the background information for this project in addition to the new guidelines. All resources are included in this clinical practice change document. A memo by email is being distributed broadly across the province. Additional resources will include posters, and all of these resources will be available on the Best Blood Manitoba website. One of the resources available to all of the clinical units is a Transfuse Safely poster. This incorporates all of the transfusion guidelines that we have just stated previous. It gives you an indication of your hemoglobin value and what will occur at each stage. We are reinforcing that this transfusion protocol applies primarily to our non-bleeding hospitalized adult patients and that all outpatients are excluded from these guidelines. If you access the Best Blood Manitoba website, all of these resources will be available to you. We'll have the clinical guideline, the training videos, evidence to support why we've implemented these changes, in addition to a frequently asked sheet and a poster. There's a link to the training videos that you can access from the Best Blood Manitoba website for your enjoyment. Most importantly, where can I get the new request for release forms? As I mentioned, there's a request for release form for red cells. However, you will also need a request for release form for blood components such as platelets and plasma, and blood products such as Winrow or IVIG. We have provided SAP numbers for both requests for release forms. These forms will be available for ordering. In addition, they are available on the lab information website, and we've provided the link to that for you.
Along with the other materials that are on Best Blood Manitoba, we've created a clinical unit checklist, and this is aimed at helping the educators or managers prepare their staff for this change. The implementation of this protocol is planned for Monday, March 30th. While you're preparing for this, there's a checklist here of how you can obtain the supplies that you're going to need and where you can find the training materials for your staff. And at any time that you have any questions in regards to that, you can contact us through BBM, or you can contact a transfusion medicine person on call. This concludes our slide presentation on the new inpatient red blood cell transfusion stewardship project. We thank you for your time and attention to this important project.